flu is being detected at increased levels for this time of year in Southern California, a trend that officials say could foreshadow a difficult season following a pandemic-induced lull. At this point, overall influenza activity in California remains low, according to the State Department of Public Health. But given that the flu typically begins ramping up nationally in late November or December, above normal levels now could lead to further challenges later. The current levels of flu activity are much higher compared to pre-pandemic years, the Los Angeles County Department of Public Health said in a bulletin to healthcare providers. In previous years, an early start to the season was associated with a season with substantially higher influenza activity. County Public Health Director Barbara Ferrer put it bluntly, "Flu is definitely circulating here in L.A. County. I think, as a matter of fact, we have a higher percentage of specimens testing positive for flu at this point in the year than we usually have in a normal influenza season," she said Thursday. The county is not unique in this regard. As of last week, early increases in seasonal influenza activity have been reported in most of the United States, with the southeast and south-central areas of the country reporting the highest levels of activity, according to the U.S. Centers for Disease Control and Prevention. Nationally, 4% of influenza tests reported to the CDC were positive over the week ending October 15, agency data show. That's up from 2.8% the prior week. Officials generally recommend the flu vaccine for people 6 months and older. This year, officials are also suggesting those age 65 or older get turbocharged flu vaccines that are considered higher dose or adjuvanted, which helps trigger a stronger immune response. But some doctors say seniors shouldn't excessively delay getting vaccinated if they can't find a higher dose shot. A standard flu shot can be a better decision than waiting, especially if you're at higher risk for infection or severe health outcomes. Recent L County data show that 5% of lab specimens tested at county sentinel labs were positive for the flu. That's much higher than in recent years, when the positivity rate was less than 4%. In 2017-18 and 2019-20, an early start to the flu season was a harbinger of seasons with substantially higher indicators of influenza activity and severity, the county said in a bulletin. Influenza, the bulletin continued, is associated with serious illnesses, hospitalizations, and deaths, particularly among older adults, very young children, pregnant persons, and persons of all ages with certain chronic medical conditions.